Hello everyone and welcome to this exciting Insta Live by Medway India. Medway is India's leading edtech platform which specializes in healthcare and clinical courses designed specially for budding doctors and medicos. We provide various range of certificate and master's courses as well as fellowship courses all accredited by Indian and UK CPT boards to ensure accessibility and credibility to our courses. I'm Dr. Muskan, and today we are going to conduct a very special and interesting live on the topic of pregnancy and lactation, on the topic of nutrition in pregnancy and lactation. We have a very special guest with us today, dietitian Hira Tasneem ma'am. We are going to join her and have her advice and expertise on this topic. So let's begin this live. Ma'am will be joining us shortly. Okay.
अस्सलाम वालेकुम।
So, Walaikum Assalam, ma'am. So, we are live now, and let me just give a brief introduction about ma'am. Ma'am is a clinical dietitian and has a degree in sports nutrition as well. Ma'am has completed her BSc honors in HND from BZU University, and her sports nutrition degree has been done from the University of Colorado, Boulder. So, welcome, ma'am, in this exciting live today conducted by Medway. I welcome you, and let's begin with this session.
Thank you so much, Muskan, for having me here. Inshallah, we'll start.
Okay. Yes.
Then, what
So my
are
first
your
question,
queries?
yes, ma'am. So my first question for you is, what are the essential nutritional requirements during pregnancy, which are critical for fetal development and maternal health care?
Most important nutrient जो है हमारे fetal development में it's folate, यानी folic acid. In natural form, it's present in folic acid, but we get supplements in the form of folate. Then B12 vitamin and other like zinc, selenium, iron to cover up the deficiencies.
Okay.
So,
Very well said, ma'am. Yes. Yes, please go on. Continue.
if we talk about the prenatal nutritional requirements, when someone is ready to conceive, she should start taking folate supplements 1 month before conceiving, because so much deficiencies occur because he or she not taking diet seriously. Like मेल और फीमेल दोनों की ही डाइट मैटर करती है उसकी फीटस की बेटर डेवलपमेंट में। अगर कहीं भी डेफिशिएंसीज आ जाए तो न्यूरल ट्यूब डिफेक्ट्स आ सकते हैं, तो हमें इन चीजों को देखकर चलना पड़ता है।
जी. Very well said, ma'am. I completely agree with you that these nutritions are very essential for the development of fetus, and both male and female, the father and the mother, needs to have a very well balanced diet in order to have the fetus growth properly. So my next question for you is, what advice would you give to the medicos, as we have a lot of medicos on our platform? So what advice would you give to them in regards to planning pregnant women's diet? in terms of traditional diet as well as the modern diets that have been introduced, like the fashionable diets that are introduced, like आपको ये supplement लेना चाहिए या कोई और चीज जो न्यू चीजें इंट्रोड्यूस होती है मार्केट में. How would you advise our medicos to balance between the traditional diet जो सालों से हमारे बुजुर्ग बताते हैं to follow in ANC cases in pregnancy in lactation as compared to the modern diets जो आजकल prevalent है.
If we go for the traditional diet, you have heard about the name panjiri or goond. Have
Yes.
you heard it?
Yes.
Uh, this recipe is very important for gaining weight. As we know, for healthy body of a female, she should gain 25 pounds to 35 pounds weight in single pregnancy. Otherwise, if she is obese, she should gain 11 to 25 lbs. एंड दिस यानी पिंजरी की अगर हम बात करें, इट्स फुल ऑफ न्यूट्रिएंट्स B12, आयरन, ओमेगा 3, which is very beneficial for fetal development, because omega 3 is very important for the brain. So that's why it will cover up all the deficiencies. And if we go for fashionable diet nowadays, people recommend vitamin A, which is not good. As if we talk about the recent studies and research, vitamin A has very bad effect on the fetal development. यानी हाइड्रोसिफेली हो जाती है, रिटेंशन ऑफ वाटर इन द ब्रेन, मैक्रोसिफेली, आपका ब्रेन साइज बढ़ जाता है. एंड इफ वी स्किप फोलेट या फोलिक एसिड फ्रॉम द डाइट, लाइक प्रेग्नेंट वुमेन होती कहती है हम बहुत ज्यादा वेट गेन ना कर लें, she starts skipping meals. Because of that, many nutrient deficiencies occur and neural tube defects arise in the babies. And mostly females, like in western हम देखते हैं कि अल्कोहल का abuse होता है, smoking, caffeine. Then this use of these things cause fetal antenatal syndrome, यानी सडन डेथ हो सकती है 1 ईयर के अंदर अंदर बेबीज की, तो ये अवॉइड करनी चाहिए.
Okay. It was a very insightful answer, ma'am. I hope our audiences have gained a lot of experience from this कि fashionable diets के व्यतिरिक्त हमें we should follow a traditional diet जो हमें पहले से बताई गई है, which is very important and very helpful rather than other diets that we follow, the fashionable diets that we are getting equipped to. So my next question for you will be, in our clinical practice that we see while we conduct an ANC examination in the pregnant women and also after pregnancy in lactating women, how do we identify what are the signs of malnutrition or any deficiencies that we will notice in the patients?
What I notice in my patient that their nails are very brittle and ridges on the nails, um, and skin color is pale because of anemia. They are facing malnutrition or going towards anemia. It would be iron deficiency. If it iron deficiency, their nails will appear like yellow and ridges. And zinc deficiency will show skin uh, peeling side on the sides of nails. And additional vitamin C required hota hai, then they have dry skin, vitamin A deficiency, omega 3 deficiency hogi. If they are not taking a good source of fat, then their skin is rough. And hair fall, they are facing hair fall, fatigue, um, and many other issues. Like if they are not taking a balanced diet, then mostly cases are miscarriages, bleeding, etc. इस तरह के cases आ जाते हैं. Then we should examine physical examination.
Okay.
उनके teeth, यानी if they have weak bones, their teeth are यानी nails पर उनके ना white color की spotted निशान आ जाते हैं, और उनके जो teeth होते हैं वो yellow हो जाते हैं, folate की कमी होती है, और इस तरह की situation.
Okay. Thank you, ma'am, for your answer. This was really helpful. I hope our medicos would have gained a lot of knowledge regarding what to observe when we have a patient in our clinics, and go for these signs, look for these signs. So the next question for you would be, as we know, nutrition is a key component in maternal child healthcare, right? So we need to understand nutrition very properly, and we need to have a very in-depth knowledge of this subject in regards to managing our patients. What is your advice? Like, how would you suggest Medway's courses will be helpful in this thing?
Medway courses will be helpful because if you go for a practical knowledge with this field, yani by adopting special courses like related to pregnancy, you will get a deep inside knowledge about pregnancy related. But if you go for renal patients or renal cases, then it will be helpful if Medway is conducting cases on specialized cases like kidney, a separate case on kidney, a separate case on sport nutrition, then it will helpful in deep knowledge and gripping their knowledge on one field. And in the
Yes.
market, if we go for like diabetes specialist, then we should have a knowledge, deep knowledge about diabetes, how it would be screened, how it would be managed with diet. Then they should go for Medway courses.
Okay. Definitely. So I would like to tell our audiences that Medway provide a wide variety of courses of master's certificate as well as fellowship courses, and we have special certificate courses and master's courses in gynec and obstetrics as well as clinical nutrition and dietetics as well. So I would like our audience to really go through these courses, and if you are opting for enhancing your knowledge, you should definitely go for our courses. So my next question for you would be, like, as we have seen, there is so much of updates going on through the internet. Like, with the internet era that we have come, we have a lot of knowledge and a lot of updates in the field, right? So what would your advice be? Like, how would we be updated with all these knowledge, and what can we, what approach should we have to be updated with all such things, like the updates that come across to us? What one tip you would like to give to them?
Yes, as we know, there are many influencers on YouTube, Instagram, and like they are not related to nutrition field, but they are giving diet plans and doing these type of things. So we should go for authentic sites like registered dietitians and registered institute, uh, and like sources, our research sources like ResearchGate and journals, those impact factors are very good. We should go for that. Like international journals, National Institute of Health (NIH) हो गया, and other like elsewhere. Google Scholar. We can use Google Scholar for authentic sources.
Yes.
MDPI. And these sources we should go for them.
Yes, I would add one more thing, like Medway is accredited by UK and CPT boards, so we provide authentic and up-to-date information to our students who pursue these courses, and these courses are evidence-based learning. We provide a wide variety of knowledge from basic to advanced. We cover everything in our courses, so it is very helpful for this thing to update. Recommend that along with all these resources, Medway has a very special impact on being updated with all the information that you need. So my next question would be with you would be, what are your thoughts on upskilling the maternal child healthcare, and how would you build a well-rounded practice?
For a well-rounded practice, we should first increase our knowledge by getting certified courses like Medway through Medway or any other authentic institute. And then we should go for self-reading. How much you books you can read, research articles. It will build a strong evaluative yani your thinking and critical thinking. It will build your critical thinking about cases. The number of cases you will deal with, you will get the practical knowledge to how to deal with them. So we should go for authentic sourcing, then analyze, apply it, solve cases like in the exercises we get in our books, and then go for practical experience. Uh,
Moving
as
towards the yes, ma'am.
I started practice by taking free patients in my family and deal with them. Then I get the insight that I am doing good job when they get treated
Very,
with them.
very true. That is a very wonderful advice from your side, ma'am. So the next question for you would be, are there any myths that you would like to debunk on this topic of nutrition in pregnancy and lactating women? Any myths that you have come across that we should be looking for?
There is a myth that a female after cesarean or operation shouldn't eat or drink meat or milk type food products, but it is not any reality. After or within 1 week, she can use milk products and go for protein because it's very beneficial for the um, recovery as she goes from the cesarean. Then albumin required होता है in the body और हमें WBCs चाहिए होते हैं which form from the proteins. So that's why we need
Yes.
that.
Very true. The protein requirement in the pregnant and lactating women and after the delivery, it's very necessary to have your protein requirements fulfilled, and having meat and milk is a very good source of protein. So that is a one myth that you have debunked today for us, which would be very helpful information. Then moving towards the last question of from my side in this session is there any golden rule that you would like to tell to our audience about practicing in any golden rule? Sorry for the interruption. Any golden rule that you would like to tell them about practicing and about this topic?
Golden rule यही है कि we shouldn't uh, give the negative remarks all the time. Yani we should give the positive and negative both remarks to the patient so that she not too relaxed and too worried. And we should go for give yourself a time after consultation. Don't give directly diet plans to the patient. Give them a follow-up session and go for a deep study if the case is critical. Many students don't know about the diet which should be preferred to the patient about multiple diseases. So he or she go for patient contact and then send her the diet plans or next day to deal with the case.
Very true. So thank you, ma'am. Thank you for all your advice. Moving on to the next section of this live, which is my favorite section in this live. I would like our audiences to ask or drop down in the comments any of your questions or queries for ma'am that you would like to be answered. Please
Thank you.
feel free to drop in your comments. We should just wait for a while for our audiences to type in their questions.
One thing I would like to add that 1 ounces of human milk contain 20 kilocalories. So when it's a lactation period, we should add extra calories like 650 kilocalories extra required because baby can intake 7 up to 750 ml, which is equal to 650 kilocalories.
Yes.
So if a mother is not taking extra calories, she will lose weight. She will be undernourished. And mostly females not prefer breastfeeding. So it's very bad thing. Breastfeeding will help her to reduce the weight she gained during pregnancy, uh, to get back the uterus to its place back to the normal. So we should promote breastfeeding in the patient.
Very true.
It's take 2 to
Very
3
true.
weeks to.
Yes. Definitely, it is advised to go for breastfeeding after the pregnancy, and it also helps managing your weight and as well as providing nutrition for the baby. Once again, I would like our audiences to drop in the comments with any of your questions regarding in this topic that you would like to ask dietitian Hira Tasneen ma'am, and she will be very helpful in answering all your questions. Please go ahead and please drop any of your questions. Okay. Okay. Once again, I would like to ask our audiences if you have any questions or doubts regarding the topic of maternal child health care and nutrition in pregnant and lactating women. We have dietitian Hira Tasneen ma'am with us today, and if any of your questions you would like to be answered, kindly drop in the comments. Okay. Looks like as of now, we don't have any questions from our audiences right now. So, one question I would like to ask from my side, ma'am, how would you counsel a patient regarding the breastfeeding? That right now you said that ladies these days don't prefer breastfeeding. So, what one advice would you give to them to encourage them to go for breastfeeding?
Breastfeeding is very helpful for mother and child both. If we go for the baby, it will help to prevent infectious diseases in later life, obesity, because when we go for formula milk, it's full of calories and fat, which help them in gaining weight, and they become obese or and overweight and go for the chronic diseases. But if we go for human milk, it contains 100 ingredients which is not present in formula milk. So a mother should encourage to feed the baby because it has 100 different ingredients which will combat with the like HIV in later life or infectious disease, viral diseases, and it will boost the immunity, prevent infection, lung infection, pneumonia, etc. like diseases, and allergies हो जाती हैं, इसमें भी helpful होगा. But for the female, it help in preventing early conceiving another child, yani next pregnancy. It will get back the uterus to its normal size and shedding its weight, extra weight gain जो हो जाता है, and it's.
Okay. Uh, Thank you, ma'am. Definitely, I have gained a lot of information and insights on how to counsel a patient and you know promote breastfeeding, like that helps them in reducing their weight. It helps the patient and the child as well to not catch any of the infectious disease that can happen, and all the information that you provided right now. It was a really wonderful answer, and I really thank you for answering my doubt. So moving towards the end of this wonderful, wonderful session with you. Um, I would like to thank you a lot for joining in this session and providing such useful information and sharing all your wisdom with us today. So, I would like you to tell our audiences where they can find you for more such tips and tricks and all the knowledge that you provide us. Kindly tell them your Instagram ID.
Yes, my Instagram ID is just a park girl. I changed its name. but I will change it soon to dietitian Hira Tasneem, and I would like to uh, communicate with them through my diet doctors organization. Soon I will going to start a free lecture on nutrition. I have done with the PIPRC, but it's a wonderful experience with Medway Institute. Inshallah, again we will arrange a session. Thank you, ma'am.
Thank you, ma'am. Thank you so much. So, once again, I would like to tell our audiences about Medway's courses that we provide, which are very helpful for your practice as well as increasing your clinical skills. We provide a wide variety of clinical certificate, masters, and fellowship courses. Specifically, the courses that I would like to recommend today is the master's courses in clinical nutrition and dietetics, the master's courses in gynec and obstetrics, certificate courses in clinical nutrition and dietetics, certificate courses in certificate courses in gynec and obstetrics, and also we have a PG diploma in clinical nutrition and dietetics as well. So this is the information that I would like our audiences to note, and if they want to approach and have a knowledge from basic to advanced skill, we are the institute you are looking for. So, after saying all this thing, let's conclude this session today. Thank you, ma'am. Thank you once again for this wonderful, wonderful session with you today. Looking forward for more such lives and interesting lives to be conducted in the further weeks. And thank you once again. And I request all the audiences to please subscribe and like and join our lives and follow Medway as well as dietitian Hira Tasmeen ma'am's all Insta IDs. These will be provided in the tags below and also in the caption. So once again, thank you everyone for joining this session. Have a wonderful weekend.